Let's begin with our topic, which is the cancer of upper GI tract. And the first part of the upper GI tract is the esophagus. So we will discuss in this section mainly the cancers of the esophagus. In this section, when we will talk about esophageal cancer, we will focus mainly on what are the different causes or etiologies that can cause esophageal cancers, what's the clinical features of esophageal cancer, and how we diagnose and treat the cancers of the esophagus. Upper gastrointestinal tract cancers usually involve the esophagus, so esophageal cancers, stomach or gastric cancers, and also cancers of small intestine. So upper GI tract constitute, or the components of upper GI tract are esophagus, which is a long tube esophagus, and this esophagus ends at the stomach. So esophagus opens into the stomach, and then from the stomach, where the stomach ends, there is the small intestine, which is three parts mainly: duodenum, jejunum, and ileum. See, these are the three structures or parts of the small intestine. So upper GI tract, which is esophagus, which is a long tube from which the food enters from the pharynx into esophagus. And then we have, so pharynx is the part, the throat is the part which is common to both the digestive tract or digestive system and the respiratory system. And the epiglottis is the flap that closes the esophagus or the trachea when we swallow or eat. So this is pharynx is common part between the GI tract and the respiratory system. So esophagus is a long tube from which the food enters into the stomach, and from the stomach the food enters into the small intestine, which is the duodenum, jejunum, and ileum or ileum. So three structures mainly: esophagus, stomach, and the small intestine. So this is the esophagus. This is the cancer of the esophagus here, which is present in the esophageal cavity and is causing obstruction of the esophagus. Here, this is the cancer of the stomach or gastric cancer, and then we have the picture showing cancer of the small intestine. Esophageal cancer, which can be squamous cell or adenocarcinoma. So squamous cell carcinoma of esophagus or adenocarcinoma of esophagus are common. They are in cervical and thoracic esophagus part. So as I mentioned, the pharynx, the food enters from the pharynx into esophagus. So esophagus has the part that is present in the cervical region or in the throat. And then as it enters the chest cavity, that's the thoracic part of the esophagus. So two parts, one in the neck or in the cervical region, other is in the chest or thoracic part. Causes of esophageal cancer: the squamous cell carcinoma is due to alcohol consumption and in susceptibility to the development of the cancer. Smoking or different carcinogens can cause cancer. Then we have mucosal damage from physical agent like hot tea can also lead to esophageal cancer, and esophageal web with glossitis and iron deficiency. Congenital hyperkeratosis and pitting of palm soles. deficiency of some minerals like selenium, molybdenum, zinc, vitamin A. All these can cause the squamous cell carcinoma. So squamous cell carcinoma is of the esophagus is due to alcohol consumption, some dietary deficiencies, congenital hyperkeratosis, physical damage to esophagus due to hot tea. All these can cause squamous cell carcinoma of the esophagus. Adenocarcinoma of esophagus is due to chronic gastroesophageal reflux. Reflux is the going back of the acid or food particles or food we. It causes the heartburn also and gastroesophageal reflux disease. If there is a chronic gastroesophageal reflux disease or heartburn, that can cause adenocarcinoma of the esophagus. People who are overweight and they are obese is another cause for esophageal adenocarcinoma. Barrett esophagus cause esophageal adenocarcinoma. Male sex are more prone to adenocarcinoma. And cigarette smoking is so smoking can cause both the squamous cell carcinoma and adenocarcinoma of the esophagus. Clinical features of esophageal is a tube through which the food passes. So whenever there is cancer or growth in the esophagus, definitely all the clinical features associated with swallowing, eating, patients usually present with those features. So 5% occur in cervical esophagus. 5% of esophageal cancers can occur only in the cervical esophagus. 20% occur in the middle third and 75% in the lower third of the esophagus. So mostly the esophageal cancers occur in the lower portion of the esophagus, which is in the chest or thoracic esophagus. Clinical features: progressive dysphagia, difficulty in swallowing, progressive as the growth progress, as the tumor spread, as the cancer spread, the dysphagia or difficulty in swallowing becomes worse and worse. Then there is weight loss of short duration. When people do not eat properly, they have dysphagia. The first sudden effect is the weight loss or decrease in the weight. Pain on swallowing is present. There is pain in the chest because of the lower portion of the esophagus is affected, which is in the chest or thoracic region. There is pain in the chest. Regurgitation or vomiting, hypercalcemia. So there is regurgitation, vomiting because the passage of the food is not clear. So patient regurgitate and vomit, and there is also hypercalcemia or increased level of calcium in the blood. Aspiration pneumonia because of the regurgitation. Sometimes patients they aspirate and they have aspiration pneumonia. So all these are very common clinical features, and these are all the features that are present with the esophageal cancer. And also tracheoesophageal fistulas are formed, and then there is a passage of food particle into the trachea and air into esophagus, and that can cause breathing problems and difficulties, and more commonly aspiration pneumonias, because the food particles can easily aspirated into the trachea and goes into the lung. So all these are common clinical features associated with the esophageal cancer. Diagnosis is by the esophagoscopy, the examination of the esophagus, and then direct visualization of esophagus to look for any tumor, mass, swelling present. Cytologic screening. So once esophagoscopy is performed, then usually after that the tissue is removed, biopsy is done, and then the cytological screening is performed to find out if its changes are the cancerous cells are present or not. Histopathologic confirmation after cytological screening and biopsy. Histopathological confirmation is done. Endoscopic inspection of larynx, trachea, and bronchi. Examination of stomach fundus is also performed. Ultrasound and CT scan and the PET scan all the tests are done for the diagnosis of the esophageal cancer. Treatment is the surgical. It can be total resection. Then we have esophagectomies, fundoplication surgery. This is the picture that shows the fundoplication surgery, in which the fundus of the stomach is wrapped around the esophagus. So this is fundoplication surgery. So esophagus passes through the muscular portion of the stomach. Then we have chemotherapeutic agents like trastuzumab is used for the treatment of esophageal cancer. Also anti-angiogenic agent like bevacizumab. So these are two very commonly used drug. Chemotherapeutic agent is trastuzumab. And then we have anti-angiogenic agent, which is bevacizumab. Then the combination chemotherapy and radiation therapy, repeated endoscopic dilation, gastrotomy or jejunostomy, and also placement of metal stent. This is the metal stent that is placed to keep the esophagus open and functioning. So these are all different surgical procedures or treatment options that are used for the treatment of the esophageal cancer. This was all about section 1, in which we discussed the esophageal cancer. Thank you for watching sqadia.com.